I am a plant breeder and I work at the National Crops Resource Research Institute, abbreviated as NaCRRI. NaCRRI is a public agricultural research institute which is under the policy guidance and coordination of the National Agricultural Research Organization, NARO, in Uganda. I'm exploring food systems as solutions, dietary-related non-communicable diseases, and anemia, specifically focusing on the nutraceutical healing properties of common bean and other legumes to treat and prevent these diseases. According to the World Health Organization, cancer, heart disease, and diabetes cause 41 million deaths annually. Anemia affects 1 in 3 people, and iron deficiency anemia being the most common form of anemia. Yet some of the affordable superfoods like black beans and mung beans that can be consumed to treat and prevent these diseases remain globally. Black beans and mung beans are rich in iron, potassium, and magnesium, which makes them important foods for preventing anemia, high blood pressure. Unfortunately, there is low consumer awareness about their health benefits. And even where these beans are traditionally included in the diets, the quantities and frequency of intake are too small to deliver nutraceutical health benefits. And these are the critical gaps that need to be addressed. My big bet is to exploit black beans and mung beans both as food and as medicine in the fight against chronic non-communicable diseases and anemia through regular consumption, breeding, and as a feedstock for the nutraceutical extraction industry in Uganda, Africa, and beyond. My big bet comes from available scientific evidence and my personal real-life health experience. To realize this vision, I want to build partnerships that combine available scientific information with my real-life health experience. Hence, there is need to build on this research that was started in my home kitchen. This therefore calls for collaboration between government health facilities, NARO, Makerere University, CIAT, nutritionists, and international partners. There is need to integrate these beans in existing government feeding interventions and policies, school meal programs. There's also need for mass media campaigns to raise awareness. Need to strengthen our breeding programs to solve production constraints and also to enhance nutrition and nutritional qualities. The opportunity I see is a future where both black beans and mung beans are widely eaten both as food and as medicine, helping to prevent and manage chronic non-communicable diseases and anemia in Uganda, Africa at large, and beyond. The more literature I've read about black beans and mung beans, the more I believe everybody should start regular consumption of these two legumes and in sufficient quantities. Uganda already has a unique advantage. Our black bean, narrow bean 7, is also iron biofortified, meaning it can directly address anemia if people learn to eat it both as food and also as medicine. Elsewhere, basing on rat models, some researchers have also reported black bean cultivars with anti-diabetic and anti-cancer effects. So I think there is need for deliberate global efforts such that these beans can be also consumed widely. By integrating these legumes in our daily diets, we can transform health in Uganda, across Africa, and beyond.